Hi everyone, welcome to session 4, the last session of our mid-year program. Thank you guys for joining us. We'll give everyone a couple more minutes to join. Hello to everyone who just joined. We're going to give everyone a couple more minutes, maybe just a minute or two, because we do have a very amazing lineup of speakers. So I want to get right into it since we only do have an hour. As always, throw everything in the chat feature. I want to hear from you guys, and feel free to comments, questions, whatever you have. Okay, so I know we're going to have more people joining, which is okay, but I'm going to get us started. So thank you all for being here. Like I said, for the last session, so sad that we're here because I think we've covered off on a lot of amazing topics, and all of, connecting with all of you and everyone's participation has made this so amazing and so valuable for all of us. So thank you guys for joining once again. Just a couple of housekeeping items as usual. If anyone's having an issue, I know there's a ton of people registered, and then we always have a little bit of a delay with people getting on. So if you know anyone who's having any trouble getting on, make sure to remind them to register their name, email in Zoom, and they'll get the link sent to them for the session. That's nothing new. The evaluations will be sent out after today's session. At that time, you'll have an opportunity to put your CHES number and which sessions you attended in order to get credit. So that's how we're going to go about that. What else do we have? So I'm sure many of you saw, but in case you have not yet, it was brought to my attention, I was unaware, that NCHEC is giving credits or CEUs to individuals who have worked for the COVID-19 efforts from a public health perspective. So if you are one of those individuals, be sure to check that out. 15 credits is a lot, and I'm sure many of us will benefit from that. So be sure to go on their website on how to become eligible for that. Also, this session, we will have a networking session immediately following from 5 to 6, as we did with the first session. So feel free to, take a short break after and then hop right back on, because we are going to connect with one another and, continue the conversation that we've been having, which has been amazing. And then I already touched on this, but please feel free to use the chat feature. We have 3 speakers today, which is more than we've ever had in one session. So in order to keep it to time and keep it organized, we're going to save questions till the end, but feel free to put any question in the chat feature. I will keep, a running list of the questions, and, I'll ask them to the participants when we get to the Q&A section. If you have a specific question for one of the speakers, I said participants, speakers, if you have a question for a specific speaker, you can say that, or you can just put a question on, and I'll just randomly ask one of our speakers. So that's how we'll do the Q&A. So let's just jump right into it. The topic for today's session is really around showcasing some of our very own members who have done amazing work the last couple of months in response to COVID-19. So they all have slightly different roles, but their insights and sort of their learnings and what they're going to provide us today is going to be super valuable. And I just really wanted to give them the opportunity to share their stories and their experiences, because we watch TV, we, have speakers talking about various subjects, but we have so much of that knowledge within our community at NJ Sophie. So it's really important that we bring attention to those individuals. So without further ado, I'm going to introduce our first speaker for today. She is no stranger to NJ Sophie, Candace Davenport. Candace is a health officer, a nurse, a public health nursing supervisor, and a health educator for Maplewood Department of Health. She has been a past president of NJ Sophie. She is actually the reason that I joined Sophie, and she has been a part of NJ Sophie for 20 years. So Candace, take it away.
Hey, Sanika, super proud of you as always. Hi, everyone. Zoom is such an interesting function for health education and learning and distance learning. So always super proud of our health educators for jumping into it and jumping into technology and being super flexible with our and adapting to our continuing education. So I just want to say that as a health educator for almost 20 years, close to 20 years, it has given me great perspective on dealing with this COVID-19 global pandemic. It has enabled me as a health officer to do a lot of the things, and a lot of the focuses on behavior change, which we've all had to do some major behavior changes and adjust to some major social norms since we've started this back in February. So I want to say, first off and foremost, that being a health educator, you'll see a difference with health officers who are pretty much the CEOs of your local health departments, who are who have health educator backgrounds, versus health officers who may not have a health educator background. I think with the health educator and the CHES and MCHES competencies, they ask more of us as health officers and enhance our position, in terms of like looking at data, assessing data, implementing that data, translating that data, and then synthesizing it. One of my most important jobs here as the health officer is to educate the public, but also to educate our local elected officials and policymakers on what we need to do in order to prevent the spread of the disease, in order to enable the stay-at-home orders, and now in this current moment, how to reopen safely. As a public health nursing supervisor, health education has helped me greatly because we were in charge primarily of case investigations, and now we're moving on to contact tracing. But the case investigations and contact tracing all require education regarding the difference between isolation and quarantine. What does it mean? What are the differences? The importance of testing and why that's important, and who is it important for? How to avoid large crowds, how to wear a face mask. Use of face masks is a great message that has definitely changed in the during COVID. In the beginning, we weren't even asking people to wear face masks, if you recall. And the only 3 symptoms that we were looking for were fever, cough, and shortness of breath. Now we are looking at many more symptoms and having to adapt that messaging. But also regarding face masks, you know, now it is, now we have to talk about that it's required to have on your person, and then to use it when you cannot guarantee the 6-foot distance from other people and maintain social distancing. So that is definitely a huge important message, and one of the key messages I'm sure the other speakers will talk about. One of the things as a health educator in my experience has been risk communication. So if you have not looked into risk communication, that was essential for us to take as training back in 2001 and 2002 when we were dealing with bioterrorism and public health emergency preparedness. The connection between health education and risk communication really is key and essential. I truly believe that everyone should have the training in risk communication, but health educators come at it with the training of understanding how important behavior changes, right? And community behavior change. And how do you convey that information to not only individuals, but also to the general public, so that, as we always know, the population is our patient, right? The population is who we are looking to influence and make behavior changes so that we're all healthier. So it has helped us to like get trained to listen and to persuade, to educate. But most importantly, listening is super important because we have to understand what messages are getting through to people and what miscommunication we have to untangle and then re-educate on. So I'm going to refer to the chat function or pass it on to Sunika to have people move on to the next speaker.
Okay, wonderful. Thank you, Candace. Yeah, we'll save the questions. We'll save the questions for the end, but thank you for that. If anyone has any questions for anything Candace spoke about or introduced, feel free to put it in the chat feature. So we are going to move on to our next speaker for today, Angelica Espinal Garcia. She is a MPH and an MCHES and is the health educator at Freehold Area Health Department. She's the coordinator for Health Improvement Coalition of Monmouth County. She's been promoting and advocating for healthy behavior, health equity, and access to healthcare and community resources through collaboration and partnership with local community partners and residents. She received her master's degree from the Rutgers School of Public Health, go Rutgers, and she joined NJ Sophie in 2018. So thank you so much for being here today, Angelica, and she's going to be talking to us about her experiences, you know, being the front lines of COVID-19. Thank you.
Hi, everybody. Thank you, Sunika. I'm also going to try to stay away from that word collaborative or collaboration. You know, it can be tricky sometimes, but it's really important, right? And I'm going to discuss that later. I would say that, like everybody else, my work has shifted because, you know, we have new priorities that come with this pandemic. But something that we can all agree on is that this pandemic also has stressed and featured the importance of all that we as health educators, public health professionals have been advocating and promoting, which is healthy behaviors, health equity, and access to healthcare. And this has been stressed, it's been actually being more out for the public to recognize that, and I think it's something that encourages us to keep doing what we've been doing all this time. And as far as roles, if I gotta think about those priorities, and as a health educator, I consider myself to be a people person. I'm out in the community. I love being out in the community. And that I had the opportunity to be doing even before we had some restrictions on the gatherings. And I was able to do some education and awareness on COVID-19, whatever we knew back then, because as we're still learning, every day is something new. I was able to go to the houses of worship, community-based organizations and food pantries, doing some awareness and also providing some information on what the signs and symptoms were, and also some of the precautions and protocols that will keep us safe, and also what we are actually keep as our family or loved ones safe. And also, as these continue moving forward, I was pulling in what in most health departments, all staff members were pulled into the case investigation or contact tracing. And I wouldn't ask for a better team. I'll say my colleagues are really great. I also have a privilege to have a great leader in the health department. And we've done a really great job. And because of my connection to the community, and also the fact that I'm bilingual, by doing those interviews, and I found myself to be a really used as a resource person. Doing the interviews, during the phone calls, I was able to identify that maybe, I would have some callers asking, for instance, where to get tested. But then I was able to identify there were other needs that they had. They need to help navigating just not the COVID-19 testing services, but also the healthcare services. Some of those residents didn't even know where to go to just to get a regular checkup, for instance. So we also have some other, emotional supports, for instance, and other social services that I was able to help navigate through. So those are the roles or priorities that say that they interconnected and also they overlap, doing the health education, the awareness, the case investigation, and also providing all those kinds of resources. But what I like to share here with you is some of the experiences, with the challenges that that we all as health educators, professionals, we faced, and it was actually the inequalities. We know there are some communities, we know the Black community, the Hispanic community, that were hit very hard because of, we all understand what the social determinants of health are, the impact, and also, for instance, in the Hispanic community, a large number of Hispanic were identified as essential workers, which means they were, they didn't have a chance to stay home. They need to go to work, whether it be in supermarket, they need to go over to work in restaurants, warehouses, factories. So they were at really high getting increased risk for getting contracting the virus, and not only contracting the virus, but bring the virus home, and also higher risk for spreading the virus. And that was also something that will put them into that disadvantage. And we have some other social economic factors. I know, as you may already be aware, there are some benefits that, like for instance, the undocumented population are not entitled for, like unemployment, and even taxpayers. They have US born children were not included in the package for getting some financial support, or what is called the coronavirus aid or relief or stimulus check, just because they have a tax ID number, but they don't have a social security number. So those factors contributed to the fact that they got a higher risk for infection because they couldn't stay home. And it comes challenging when we as health educator and we're doing the interviews and we asking them to self-isolate or self-quarantine. And when they facing those problems where, they gotta, they had to, I would say, choose between, keep themselves and their families safe or bring in some, food to the table and all those kind of, so it's very challenging in my, from my perspective, knowing that. And also another one besides that is the social stigma. Based on the CDC, as you can see on this slide, the definition is a discrimination against an identifiable group of people, place, or a nation. And stigma is associated with the lack of a knowledge about how COVID-19 is spread, a need to blame someone, fears about diseases and death, and gossip that spreads rumors and myths. As I was doing the interviews, I came across different situations, mostly with the Hispanic community. There was some social stigma among themselves, which means there was some fear. I identify or was able to witness some of the cases where they will call me and as I was asking for some information, luckily, like I said, I've been out in the community and there's this trust, so they were able to provide me, because part of the interview is identifying who was close contact, within this 6 feet of distance and for longer, for more than 10 minutes. And I was able to get all that information because they trust them, they knew that I was trying to help, or we were as a health department trying to help reduce the spread of that disease. But also there were some concerns. Some of them will say that, they were afraid of being kicked out of the room. Some of them were subletting a room, for instance, and they have roommates who, because, they knew he was positive for COVID-19, they were, there was some fear, there were some rumors, and also there were some other misinformation that they were getting from, because, even the countries that are coming from origins, there are some practices that they probably continue to be doing here. For example, the mental health stigma is kind of similar to the COVID-19 also, social stigma, when if you already contracted the virus, for instance, if you are positive, even though you have recovered, they will still be fearful or, being close to you. I had some of those instances of situations where I was put on a speaker, so I will talk to their family members or roommate to explain, how they were able to follow some of the quarantine guidances and how they can, keep their distance and using the face mask, and that would help, to prevent contracting the virus. So also another thing that is very important, I'd like to share that, as already been pointed out, the health literacy, or, which comes under the risk communication. And also wanted to bring in the fact that there's some cultural, competency that we need to also be aware of. It's very challenging, like I said earlier, as health educators or someone that is providing those kind of guidances, simple, like keep your distance or wear your mask, or, if you are positive and you need to self-isolate, how we can get that message across. And one of the things that I would encourage, if you work, with the community, in that community, is that there are other coalitions out there, there are networks out there for whatever the community you're working with is. For instance, the one that you see on the left, use it, and we know as health educators, we know different mechanisms that we can use. The visual aids are really important, but this one comes from a network that's called Endelan, and they work with day laborers. In one of the towns that we serve, we work with, we have many day laborers, and they were the ones that were mostly affected by or impacted by COVID-19 because of the, the natural or the work that they do. They had to be taken in, to their job or workplaces in the same car. So we had a lot of cases within the day labor community. And I found, as a health educator, I had the, the training, I had the skills to identify some of the materials that were out there and making sure they had the right information. And if I needed to adjust or add some of the, credible sources or information. And like I said, that's one of the examples. There's many out there that we don't need to reinvent the wheel. We just gotta make sure they're sending the right message. For instance, and this is the Spanish one, and you can see how is relevant to the community. They're addressing the day laborers. Different jobs that they can, perform, so that they can identify with that. And also, one of the things that I found it important for me to understand, like the culture of the community, was because in the beginning we were addressing and, we're talking about keep your distance 6 feet when you go to the restaurant, rather the supermarkets and these other, stores. But one of the things that, because I knew and I also heard people talking about as doing the interview, that the only places that we're actually going over the weekends to do, it was doing the laundry. And that's something that, we may take for granted when we have our own laundry room in our home. So that particular community, we're using the laundromat a lot. So I was able to identify that and work on some of the posters, modify it and make it visible and talk to the persons in charge in the laundromat. So we can get that message out, and they can also see that, all the places, it's very important to know what the places are that they're frequenting and what kind of message they need. And that's what I've been doing, basically. I've been doing what I love doing, being out in the community, talking about doing some educations on COVID-19, how to prevent it and keeping the hygiene practices, and going out there with the food distribution, working with local community-based organizations and also coalitions, doing food distribution. I know that's another topic, but now since I can't go out, in the indoors, but I can go out when we're doing the food distribution, for instance, and do a one-on-one. And very important for people, for our community members and residents to know that we are out there, we are here, and they can always count on that, and us rather. So, and I will, going back to all those challenges that I see being a member of New Jersey SOFI, when you put, programs like this together, help us getting more training on those kind of topics like health literacy and also cultural competence. And these other topics are very helpful to help us do a better job of what we, being asked, or we actually, are on the front line and we are doing, and sometimes even we are on the front line, but kind of feel like we are in the back stage as well. But we know we're making a difference. We believe in that, and thanks for everybody, everybody for what you're doing. This is an effort. This is a team effort. And if you have any questions, you just let me know. Thank you.
Thank you so much. That was amazing.
Thanks.
And we have a lot of questions for you. So we will get to that, and it will probably end a little early, which is nice because now we can have a good amount of time for questions. So definitely include all of them in there for any of the speakers. So I'm going to introduce our last speaker for today. She's going to close out our session. I'm going to leave my camera off just for connection. But next we have Danielle Barch. She is a health educator with the New Jersey Poison Control Center. She's been working there since early 2017. She is a graduate of New Jersey City University. She is a certified health education specialist and has been a member of NJ SOFI since 2015. Starting in the fall of 2020, Danielle will be attending the Rutgers School of Public Health, working towards her master's in public health with a concentration in epidemiology. So Danielle, take it away, and thank you for being here.
Thank you. I'm just gonna get this. There we go. Okay.
Yeah.
All right. Thank you so much for giving me the opportunity to speak with everyone today. So I'm going to try to cover just briefly what the New Jersey Poison Control Center has been doing over the last few months. We've still been operating the Poison Center as close to business as usual as possible. There have been some modifications here and there that we've had to do, as everyone has had to. But as far as the services that we offer, they remain largely unchanged. So the Poison Helpline, which is 222-1222 is still available 24/7 to provide emergency support, information, and answers to questions. And we're also still available to provide our Poison Center programs virtually. We've taken a lot of our public education materials and we have them available for download through PDF because we're unable to send them out physically at this time. So, as far as the Poison Center, a lot of what we've been doing remains largely unchanged. One thing, though, that is new to us is that starting in late January, we also started operating the New Jersey COVID-19 coronavirus hotline, specifically the side of the hotline that would provide medical information and assistance. So I'm going to cover a lot of my experience working with that hotline and how we in the education department have been working to try and, find some sort of synergy between these two lines. So my position with the center is as the health education specialist, and along with our director of public education, Alicia Gambino, we are responsible for creating, implementing, and disseminating poison prevention information and education via social media, press releases, educational programs. We're responsible for maintaining and updating our website, as well as cultivating community partnerships and, of course, community outreach amongst a million other things as they come up. Prior to the COVID-19 pandemic, my job was, very largely to kind of operate as a one-woman traveling roadshow, doing educational programs all over the state, attending meetings, community events, presentations, and generally spreading information about the Poison Center and the resources that we provide. Obviously, that was not able to continue the way that it typically did. So around the end of February or beginning of March, our management team made the decision to temporarily suspend in-person presentations and events. And honestly, by the end of that week was around the time when we really started seeing cases popping up in New Jersey and New York with great frequency, and calls to the hotline. The surge volume was just intense pretty immediately. So as I said, we've been operating the COVID hotline through the New Jersey Poison Center since late January. And right off the bat, we did see, we saw calls start coming in, and then there was a little bit of a lull. And then once we hit the end of February, beginning of March, there was a huge surge of calls to the COVID line of people who had concerns about everything from testing to wanting to know if there were cases in New Jersey and where, to wanting to know what the coronavirus was or what COVID-19 was. And, we really had to find a way to meet that demand. Here, I just have some general information about poisoning in the state and the Poison Center. But I am sure that some of you are wondering why the Poison Center would be involved in this type of venture or, this kind of project. And I think the best way to answer that question is to briefly discuss just a little bit about the Poison Center and how we operate. So as I said, we are available 24/7 through the Poison Helpline, which is 1-800-222-1222. The New Jersey Poison Center is part of a network of poison centers across the United States, many of which have been integral to their state or region's response to the COVID-19 pandemic. Poison control centers were the earliest pioneers in telemedicine. Basically, the entire way that we're able to provide healthcare information is telemedicine, and it's been that way since day one. For the New Jersey Poison Center, we are the state's only certified regional poison center. We deal with all of New Jersey and only New Jersey. We're part of the New Jersey Medical School at Rutgers University. Although we do serve the entire state, our offices are located in Newark at University Hospital and at the New Jersey Medical School. We are staffed and operated 24 hours a day by medical professionals, so specially trained doctors, pharmacists, and nurses. And we are already equipped to take hundreds of calls a day, although there were some modifications that had to be made to accommodate the vast increase in the call volume that we had seen over the last few months. And actually, in a minute, have a slide that'll show you a normal day from the Poison Center, and then one of those huge volume days in March. So calls to Poison Centers are always free. They're confidential, and with the use of a language line, calls can be translated in almost any language. Additionally, because we're taking calls and responding to issues as they're occurring, we're able to provide near real-time feedback to stakeholders, decision makers, those working on the front lines, and we're able to, impart the information that we're collecting. So things like, what kind of questions are people asking, or what do they need to know? What's working, what's not working? Where do we need to focus our attention? Although calls are confidential, we are able to provide or gather a general snapshot of where calls are coming from and what information people are looking for. And this gives us, a really good picture of where issues are occurring or what areas may be the hardest hit, and then, where we're maybe lacking in certain information and things like that. We don't just do this with the COVID line. This is also how we operate the poison hotline as well. So with the poison hotline, we're able to identify where, maybe a potential outbreak is occurring based off of call clusters and those kind of things. So we're basically, we're set up inherently to handle these type of hotlines. We've operated other emergent health hotlines as needed in the past, including the Zika and Ebola information lines. We did, when this hotline was first announced, we were using the poison hotline, with, again, that 1-800-222-1222 number. And although when you're standing in New Jersey, no matter what kind of phone you're calling from or where your phone is from, it is supposed to go to that center, technology, and there's always some kind of glitch once in a while. So we found that some calls were being rerouted to our fellow poison centers, and they were, starting to receive multiple calls from New Jersey residents. So we have switched our COVID number to a health hotline number, which is 1-800-962-1253. Again, goes right to the Poison Control Center. But with this number, you will be guaranteed to speak with somebody in New Jersey and not potentially be rerouted to another poison center. Because information evolved so quickly, we did not operate with a script, as has happened with certain other hotlines. Rather, we provided information based off of briefings and talking points that were provided by the New Jersey Department of Health, the CDC, other public health institutions. And our management team has been in constant contact with representatives from the state to ensure that we always have the most up-to-date information available to us. And, if there's ever any question that comes in, they're able to make a phone call and get clarification on things and make sure that we really are providing the best information possible. So as I said, we took on this hotline in late January, and by early March, the call volume went absolutely nuts. I'm gonna switch to this slide for a second. On the right, I think that's correct, unless it's mirrored, but the one map will show you what a typical day to the Poison Center looks like. On this day, we had approximately 200 calls. Our call volume lies somewhere in there. And then the other map, which is from March 11th, shows that we had 937 calls in a 24-hour period. This day was actually one of a few days where we took over 1,000 calls in a day. I believe at this point we are either just over or just under 40,000 calls since the hotline was started. So I know when I spoke with Sonika about this presentation, and I've spoken to other people, a lot of people are interested in what types of questions that we've received from or to the hotline. As I said, this hotline is, the state hotline has, once the call volume really expanded, has somewhat been split between the Poison Control Center, who's available to provide up-to-date medical information, and 211, whose intent is to provide more general information. But what we've seen is really just that, people will try to call whoever they can get a hold of. So, the hotline was meant to provide general and health-related information to the public, but we found that pretty much anyone and everyone who was looking for information was going to call. So this includes, school administrators, municipalities, healthcare workers, clergy, business owners, HR personnel, and again, like I said, anyone who's just looking for some answers or clarification. So in the very beginning, I want to say people there was a lot of anxiety and fear and even anger behind a lot of calls that you'd get. A lot of people were looking for information on testing at a time where, maybe we hadn't even seen a case in New Jersey yet and there was not testing available. And they would get very angry when you try and discuss the testing process with them. People who, were concerned that because they had, they worked in the city, they were concerned that they could be sick. And, again, a lot of people are just very stressed at that time. We had a lot of people who were looking to protect the communities they serve, get some answers. So I remember one call that I personally took was from a couple, I'm not even sure which denomination, but they were calling from a house of worship and wanted to know what they should do about upcoming services. They wanted to know if they should limit how many people they had in there or cancel things altogether, and what that meant for, giving communion or other things that they would typically do. Calls from parents and even school administrators who were looking for information on what to do if somebody, a student, a teacher, a student's parents were sick. What should they do about that? HR personnel and business owners wondering what to do about their staff. So a lot of that kind of information we saw in the beginning. Once the large scale lockdown took place and people kind of, we started seeing more cases, we started getting a lot more calls from people who were feeling ill and maybe couldn't get to a doctor, or their doctor's office was closed, or had gone to a hospital, but they weren't showing certain symptoms or didn't have severe symptoms and had been turned away. We had calls from people who were looking to, who were taking care of people who were ill and wanted to know, what they should do for the person they were taking care of. And then, calls from people who were looking to disinfect areas where sick individuals had stayed, and really just questions span and the entire range of the spectrum, even to things like, how do I disinfect the produce that I bought from the fridge, or is it okay to take in my mail, all the way to, people wondering, if it was okay to attend a funeral and things like that. So it really, as I said, it really spanned an entire range of the spectrum. And now at this point, it seems that a lot of the calls are people looking for information on, going back to work, or, schools reopening, how to safely return to normal activities like dining out or going to the beach. Is traveling okay? Obviously, a lot of questions about new travel restrictions. But it seems that as people have gotten used to whatever this new normal is, the calls that we're getting seem to be coming from people who are really just looking for information on how best to live in what this new normal is. So along with the COVID hotline and the poison hotline, we've also been working really hard, like I said in the beginning, to kind of find a point where these two things meet in the middle, and to create some information that we can provide to the public from both perspectives. So these are just some examples of some of the things we've been working on. So we've been working on building up some infographics from the Poison Center for some things that we've seen. So we've had a lot of calls about sanitizers and disinfectants, people calling, concerned about or wondering about frequently used terms. And then also we're just, promoting that we've started to, along with our previous Poison Center programs, are also working on building programs that discuss poison trends during the COVID-19 pandemic. So things like medication safety and cleaners, using cleaners properly and things like that as shorter multi-segment programs. We've also updated our website to include information and resources, really, as we're seeing, we've seen a lot of people looking for testing information. So we've linked directly to the state site from our website. A lot of the information we've created is up here, almost all of it, and also our press releases, whether related to COVID-19 or just poison-related press releases. We also have here, as you can see, back in February, Senator Menendez came to the Poison Center to hold a press conference discussing the COVID hotlines opening. And that's all I have for everyone today, but I did want to just share my information if anybody has any questions or would like to schedule any programs. And also our social media platforms are there, as well as our phone numbers and our website. So thank you all very much, and I'll send it back to you, Sonika.
Thank you so much. That was awesome and super helpful. Let me turn my camera on here. Okay, great. So thank you to Candace, Angelica, and Danielle. You guys are awesome, and that was such valuable information. And we have a ton of questions, so I'm going to try to get through as many as I can in the next 15 minutes. And if anyone has any that they haven't asked yet, feel free to put it in the chat. So Candace, this first question is for you.
Sure.
We talked a lot about risk communication. You touched on it. We had a session about it. And because in this specific situation with COVID-19, the information that we were receiving early on, it was constantly changing, right? Because no one really knew what was going on. And as health educators, we play that messenger role, which is a tough role to play sometimes, especially in an environment where we don't always have the definite answers. So how did you as a health educator in this situation, I mean, obviously we might, with some people, lose an element of trust because it's like, well, you told me this before and now you're telling me this, and that frustration. And we know that we're just limited with the information that we have, but how can we as health educators sort of address that issue of people not trusting us because information is constantly changing? And what are some ways to that?
Yeah, so that's a really hard question. We have gotten phone calls from residents who are just confused, like they get frustrated when we tell them to wear a face mask, but then they go to a park and no one's wearing a face mask. When they go to the beach or, another public park and they're like, I'm doing what you're telling me to, but this is not happening. So what's the deal? A lot of the things, like for a face mask, for example, the switch of it had to be that the face mask is not there to protect you. The face mask is to protect others from you. Huge message that we needed to convey, because then it wasn't about, oh, I'm protecting me. I'm doing this as a social responsibility and civic courtesy, to which then it became, unfortunately, somewhat politicized in some areas. But it shouldn't be. Public health should not be political at all, especially when we're trying to protect everyone's health, regardless of their, political beliefs, right? We're all just neighbors. So how do you do that? You go out with messages. You go out with messages that are consistent, and you try to stop that miscommunication right at the bud. So making yourself super accessible to people, whether that be via Facebook, via social media, via phone call, via email, and just giving them the answers to those questions readily, and having I would say, a good temperament that people can approach and trust, and that is reliable. So it's making yourself the steady in the storm, which I think is what people gravitate to. If you look at the people who people are looking to, you know, I think of Dr. Fauci, I think of other public health people. People listen to you if you keep your messages short, consistent, and accurate, but also with a sense of compassion and humanity mixed in.
Yeah, I think the compassion component is very key. And just to follow up to that, do you feel like it would help or hurt us as public health educators to, when we're giving messages early on, do we say like this, do we draw attention to the fact that this might change and we're still learning, or does that hurt our credibility? Like, how do we manage that potential for a disclaimer? Should we be doing that or should we not?
One of the most important things that we learned in risk communication is the ability to say, I don't know, but I'll get back to you.
Yeah.
Super important to embrace the, as Brene Brown would say, lean into, or whoever it is. So, you know, lean into the I don't know. And that's okay, because I think people will trust you more. But to know that when you say you'll get back to me, you will get back to me. And then following up with that. One of the things I do want to say is I know that some health educators may be staff and may not be, you know, at like the top or the head of the organization. What's super important is that you become the person that gives the head, whether that's the PIO, the administrator, the mayor, your health officer, whoever that is, the director of your division or department or organization, you make sure that you are the right-hand person. You don't have to be up front all the time, but you have to make sure the person up front has the right messages and does not deviate from the message. The message has to be consistent.
Right. Yeah, that's helpful. Thank you. Okay, so a question for Danielle. When you, I mean, obviously, answering the phones in this situation is not easy, and you're sort of, in some cases, a punching bag, for lack of a better word. People are frustrated and impatient, and you're the one on the other end, and you're kind of receiving that. So did you feel like you were supported along the way, or you know, what was sort of done for individuals like you who sort of had to take on that responsibility from like a mental health support standpoint, whatever that looked like? Were you getting it? And if so, like in what ways? And how can we, you know, how can organizations and other health departments support individuals who are feeling that stress because they are on the front lines? And not only in like a healthcare provider setting, but, you know, in what you were doing in your work.
Yeah, I mean, I know, like, organizationally, absolutely. Like I said, I mean, our management team, I don't think there's a better, like, there's not a better one anywhere else. They're always available, you know, checking in, like, if when people started working from home, or, you know, a lot of us largely started working from home, or would go into the office once in a while. They'd always call and check in and make sure everybody was doing okay. Constant reminders to, you know, when we're in the office, take a break, you know, take time to go take a walk. If you have a difficult caller, you know, take a minute to take a breath and, you know, come back to it. So organizationally, absolutely. I mean, other than that, I think a lot of it would also be having like a strong support system just outside of work. You know, I like a lot of check-ins from friends and family members. I mean, usually the call would start with, oh my God, what do I do in this situation? But would then, you know, go into, how are you doing? But yeah, I mean, I definitely feel like there was a lot of support. I think a lot of things, even now, it's kind of just, you know, I find that I personally will get frustrated. You know, you see certain things on the news, or in you know, you go out in public and you see certain people acting certain ways or saying certain things. But I think the best thing is really just doing your best to try and educate people as much as possible, so that I think most people really, you know, they do understand the severity of the issue and are, they're very, supportive. But yeah, I mean, I have found, it's supportive, and definitely there were points where it was like, oh, this is a lot. And you did have to take a step back. But like I said, I mean, our staff is really one of the best, and everybody was really supportive of each other.
Yeah, that's amazing. I think the people who you work with make all the difference, and it can really make or break your perspective and your experience. So for sure. I do have another question. This is sort of, I'm sure, on everyone's mind, but did you receive any calls asking about potential vaccines? And do you have any insight that you can provide us on what you're hearing about when that might be happening?
As far as insight, I mean, not really, pretty much just the same as what everybody else is hearing or has heard. As far as calls, though, we did have a lot of calls from people, and and still most likely are a lot of calls for, is there a vaccine for this? Is there a treatment for this? Just even that simple. And you'd have people who obviously are going to be concerned about that as new vaccines roll out. But yeah, we did have people calling just wondering, is there some kind of vaccine for this? When will there be a vaccine for this? Those kind of things. And obviously we don't really have the answers to when, but then along with the vaccines, we had a lot of calls from people who would wonder, who would ask, is this specific medication going to help if I get COVID-19, or would it help to keep me from getting COVID-19? I also had a few callers, I know, especially early on, who I spoke with, who wanted to know if, the pneumonia vaccine would help, kind of keep them from developing severe symptoms, or even the flu vaccine. So, wondering if these existing vaccines could help. And obviously, you just kind of have to say, at this time we don't know, probably not, but yes, as far as that, we did see those kind of questions.
Yeah, I'm sure. Thank you so much. Angelica, I have some questions for you. So when we think about, the Hispanic community and their experience with healthcare providers specifically, what are you hearing from them around the cultural competency of healthcare providers? Do they feel like they're meeting their needs in that way, or is there still a discrepancy where they're not meeting it and we have to do better?
From what I've been hearing, I'll say we still need to do better, especially because sometimes we think that addressing language, for instance, would be enough. And we're doing much better in that sense. There's been interpreting services and lines that have been really helpful. But when it comes in general about treatment, for instance, there are some cultural beliefs in the Hispanic community, like home remedies, for instance, and they can be turned off if a healthcare provider, sometimes they're not even asked what they've been doing at home first to start off. And second of all, if they, mention that, they say, oh no, that's not a treatment, that's not gonna prevent it, lack of doing that sort of education there, and which brings us back to the health literacy as well. So once they are turned off and turn off rather than, and so they, might not feel that they can trust the doctor doesn't listen to them, for instance, and other factors, even maybe they cannot even afford medications. So that, becomes a challenge or a barrier, I would say. And that reminds me of an example, which more towards the health literacy. Somebody called me, one of the residents called me, asking me for, information on seeing a cardiologist. And I kind of had to go back and ask what was the reason, having any symptoms, or he already saw the doctor. So bottom line, he was saying that he was concerned because he was discharged from the hospital. He was a COVID-19 patient. And I know some of the hospitals are doing the treatment protocol that would include anticoagulants, and aspirin was one of them. And he finally said that because he was prescribed aspirin, something must be wrong with the heart. So that's why he, so some health literacy and also some cultural myth, beliefs, and even lack of information or education at some level.
Right.
So,
And sort of to that point, and this might be a hard question to answer, just identifying one thing, but if you were to identify the biggest shortcoming or gap that still exists in properly serving the Hispanic community when it comes to, you know, any health issue, what comes to mind? You know, what are, yeah. I'm
What
sure there's
comes
a lot, but
in general, I would say reaching out and engaging that Hispanic community. That's the challenge. It takes time. You know, it's about, you know, gaining some trust. And I know Linda Brown, I have the privilege to work closely with her, and we do an access to food and you know, what services you provide, making sure you also giving a sense of dignity and trust and provide a good service because that will make a difference. Word of mouth, that's a mean of communications, regardless of the state or the town or city that you are working with. That spreads really quickly, and you know, that trust relies on that. What are you providing? What are you telling them? And also they make sure, you know, whoever, it depends on their own experience, and they can pass that down along, and that will help to the, you know, reaching out and engagement as well.
right. Awesome. Thank you guys so much. We are at time. I feel like this
Thank you.
hour flew by. Thank you to our wonderful speakers. Thank you to all of you who are here with us today and have been attending all the sessions. The support is amazing, and we wouldn't be able to do this without all of you. So thank you for being so engaging. I think I touched on everything earlier, but if anyone has any questions, feel free to reach out to me. Reach out to any of the speakers. We'll be sure to connect with them to get their slides and put it on our website for all of you to reference. And if you want to all just take a 5-minute break, step away from your computer and join us back here for a networking session that will be led by Carolina. So we will see you all very soon. Thank you, guys.